From the STI point of view, I said HIV, VDRL, and your liquid-based cytology or a pap smear will let you know exactly what it is. And a gynec checkup to see that your vaginal epithelial lining is normal, if there's any discharge that is taking place, any growth that is taking place, because viral growths also are quite common these days. Abortions are quite high for various reasons. The majority of the reasons is that it's iatrogenic. We still do not know even today why an abortion takes place. 45%. Then there's another set of hormonal imbalance which takes place or genetic malformation that takes place. So we have a facility now to send the products for what is called as CMA, it's called as chromosomal microarray. See, most of the time, most people don't realize that when they come for a positive pregnancy test that they do at home, they're already at 7 weeks of gestation, by which time most of the major organs of the baby are already formed. Having studied for 8.5 years and practiced for 45 years, and that girl was just 25 years of age telling me what to do, I said, hello. This is not needed. I mean, I don't tell you how to prepare your coffee at home.
Before I move on to some very generic questions, very generic for which will be applicable, last few questions on again, if sexually active young woman need to know that she doesn't have any STIs or any such challenges and she's not putting herself into troubles that will lead to infertility, what kind of tests are available? Apart from that, mental discipline, lifestyle changes, those are things. So if she is still active and she is still in an explorative mode, again, today is a very free world. So if she is going through whatever exploration she is, but she wants to ensure she's healthy, she's fit.
So most of the companies that are there in the market, each one of them will have a pre-employment test being done, or they have an annual checkup that takes place from the company.
Okay.
Most of these companies are tied up through the HR to a laboratory.
Okay.
Multiple laboratories are available and they run through the gamut of the entire list of investigations.
Okay.
So the basic investigation that you need to do is to see that you're generally fit is by doing a hemoglobin.
Okay.
Need to get your thyroid check done. A simple TSH should be sufficient, along with your blood sugar to see that you're not diabetic.
Okay.
If you're still pretty young, from sexual point of view,
Yes.
you need to get your HIV.
Okay.
Need to get your VDRL, that stands for Venereal Disease Research Laboratory Test.
Okay.
Need to get your pap smear done.
Okay.
You can do a pelvic ultrasound done to see that there's no growth or fibroid or tumor that is growing, and to see the antral follicular count to see where you stand with your ovarian follicles.
Okay. Okay.
If you're aging a little further, maybe more investigations in the form of a follicular stimulating hormone, FSH we call it. Along with that, you do an LH, the luteinizing hormone, which is a very important pointer. If the LH is elevated, that you're looking at polycystic ovarian syndrome.
Okay.
Along with that, you do an anti-Müllerian hormone, which is the AMH value, which is going to tell you what is your ovarian reserve standing at, and what is the chances of having good follicles for you to get pregnant in the long run.
Okay.
So the gamut of FSH, LH, TSH, AMH is the bandwidth of infertility profile as such. But sometimes to that we add serum prolactin, that is the lactational hormone, and serum testosterone, which tells you that if you got too much of testosterone circulating in your body, which will make you be prone towards PCOS.
Okay. Okay.
So these are tests from fertility point of view. From the STI point of view, I said HIV, VDRL, and your liquid-based cytology or a pap smear will let you know exactly what it is. And a gynec checkup to see that your vaginal epithelial lining is normal, if there's any discharge that is taking place, any growth that is taking place, because viral growths also are quite common these days. Papillomas we call it.
Okay.
So the viral infections that take place forms a little bit of growth in the external genitalia on the labia majora, labia minora, or in the vagina. So a proper gynec examination will throw light on this. You can see a wart or something like that, which is a growth which the lady can feel with her fingers, and they come to the doctor and say, look, I'm having this. So we think of a viral infection, which is basically herpes, and these are viral warts which need to be treated, cauterized, cut, and given proper antiviral drugs.
Okay. If she doesn't have any problem, if she doesn't have, it's a normal life. So this kind of a test, maybe once in 2 years, should
Yeah,
suffice.
the normal protocol for all these companies is to do an annual checkup.
They will do general health.
Yes, but
when it comes to the
fertility, then these things you must keep track at least once. And if you find anything getting deranged, concentrate on it.
Okay.
So, for example, thyroid. Earlier, we never did thyroid test as a routine antenatal checkup.
Okay.
But now, for every lady, the incidence of hypothyroidism is quite high. Is as high as between 45 to 55%. 5 out of 10 are hypothyroid. And this is all amongst the affluent section. You find those ladies who have a driver and they come by car and they're still stressed out and not working, not exercising. The TSH levels are sky high.
Okay.
And there's a genetic factor, a familial tendency for this. You'll find that the parents or the grandparents, some of them will be having hypothyroidism. So therefore, these traits are passed on familially.
Okay.
And stress triggers it off, and quite a high percentage of hypothyroid ladies are in circulation.
Okay.
So when you do a test, you're surprised that the TSH levels are high. You have to give a replacement of thyroxine in form of tablets. Very simple, cheap, easily available tablets. Multiple dosages are available. And bring down the TSH levels to baseline and keep a track of it once in 6 months to see that you're euthyroid.
Okay.
So there are multiple drug companies which are promoting this drug. So looking from infection, as I said, just the basic thing, maybe once in a year should be enough. If the person is very constantly promiscuous about it, then definitely once a year you need to do it.
Okay.
But from general health point of view, planning to get married or getting pregnant after marriage, we run these tests for everybody.
Okay.
Hepatitis, HCV, HIV, VDRL, glycosylated hemoglobin, your TSH levels, everything is done as a routine when they come for pre-pregnancy counseling. Along with the folic acid. We try to convince them that you must take your folic acid pre-pregnancy, maybe a month or two, which will help you to have a quality pregnancy with least chance of having neural tube defects, NTDs we call it. So these are all preventable disorders. So we try to give this and tell them to go for this, which is safe, reasonable, cheap and advisable.
Okay. Even after all these things, the pregnancy happens, miscarriages, what are the sexual behavior, how much that leads to the miscarriages?
So promiscuity prior to this pregnancy will have not much effect on the pregnancy. But pregnancy per se having an abortion is quite high. To be honest with you, tomorrow on my list, I have 2 patients who have got an embryonic demise at 7-8 weeks of pregnancy, wherein the pregnancy did happen. There was a healthy pregnancy, but the baby has died in utero, what's called as an embryonic demise. And she's now at 8 weeks of gestation, which needs a termination of pregnancy. So abortions are quite high for various reasons. The majority of the reasons is that it's iatrogenic. We still do not know even today why an abortion takes place. 45%. Then there's another set of hormonal imbalance which takes place or genetic malformation that takes place. So we have a facility now to send the products for what is called as CMA, that's called as chromosomal microarray, or what is called as a whole exome sequencing. So you can send the tissue of the unborn child which is dead to the laboratory, to a genetic lab, where they process it and find out if there's any chromosomal abnormality. Most of the times it comes normal, but there's a fair chance that it can come not T13, T18, T21 or sex aneuploidies can take place, which will tell you that this baby was not healthy. Therefore, nature took over and therefore an abortion took place, which we completed.
Okay. This was a natural reason for the abortion.
Correct.
There are also
medical problems like diabetes, hypertension, hypothyroidism, fever, radiation, too many drugs taken during pregnancy. And you find that all these things impinge against the growing baby. So there's sometimes you have bad viral infection or COVID that takes place, temperatures going sky high. That can lead to an abortion. A fall, a trauma, a hit. Some drugs can cause an abortion. So therefore, we don't give too many drugs during the first trimester. We try to minimize the number of drugs. We just try to give a folic acid. The patient will come with a lot of complaints. I'm having nausea, I'm having vomiting, I'm having breast pain, I'm having white discharge, I'm having a back pain, I'm having leg cramps. I said, this is part of pregnancy. Accept it. There's nothing wrong with you. This will subside over a period of time. Some people give anti-emetic drugs, they give painkillers, NSAIDs, all these drugs. Exactly. We do not know the babies. See, most of the time, most people don't realize that when they come for a positive pregnancy test that they do at home, they're already at 7 weeks of gestation.
Yes.
By which time, most of the major organs of the baby are already formed. The heart, the lungs, the eyes, the spleen, the liver is already forming in the stage of organogenesis between 42 days to about 60 days.
Okay.
So that's the stage of organogenesis when these people come to us with a pregnancy test positive.
Yes.
I wish they had come earlier when they got married, planning on a pregnancy, get all the investigation done, see that they're normal, take folic acid, then get pregnant. So majority...
That becomes a protective layer.
Exactly. So it's like a cocoon where you're taking care of all the parameters and then getting pregnant.
Okay.
Here what happens is they get married, they have sex normally, they don't bother about going to a gynecologist.
Yes.
And then once they miss the period, they do a home pregnancy test.
Yes.
Oh, positive. Let's go and see a
Let's
gynae.
go. Yes, yes.
And
yes.
that too, they don't come on time. They wait. Oh, today we have a party. Tomorrow we have to go out. And tomorrow day after I'm going to Coimbatore and all. All these things they finish and then they come to the doctor. By which time, it's already formed. The baby is already formed. It's just the weight gain that takes place over the next 9 months.
Okay.
So the first few weeks of pregnancy, till the 9th week, 10th week, that's the stage of organogenesis where everything develops.
While one thing, this first thing, but these are also the same period where voluntary abortions also happen because of the lifestyle choices.
Correct. I agree.
How much does that impact in future?
There's not much impact. The problem is what happens is most of these abortions can be incomplete. So they take, that's what I'm telling you, most of the time you have multiple drugs now available for abortion to take place. So they don't go to the doctor. They go to the neighborhood pharmacy. He is happy to dole out who's seen the girl grow up. Oh, meti, aapko abortion karne ka hai, you take this tablet. And she takes the tablet. Abortion does take place, but sometimes it's not complete. So you find that the products are still remaining inside the uterine cavity. She continues to bleed. Then they visit a GP. The GP gives some more same tablet. Then they come to the consultant. And then by that time, you would have found that the products are still in the cavity, which we pick up on the scan. Then we tell them, look, this needs to be cleaned out. By that time, sometimes sepsis may have set in. And once sepsis sets in, the tubes can get blocked, giving rise to infertility.
Then the only way is intervention.
Intervention from pregnancy. From this point of view, here you have to do a DNC, get the products out and keep her normal. Hopefully keeping your fingers crossed that the tubes have not got blocked in the bargain.
Okay.
And if they still don't get pregnant in the next 3 to 6 months, then all the antenna go up. There's a lot of peer pressure. The grandmother says, hey, hello, I want to see my grandchild before I kick the bucket. All these things come in. So this is the normal trend. And then they go back to the doctor. They will not go to the person who's done the DNC. They go back to another doctor. Yes. And when they go to that doctor, they don't take the medical records of the first doctor. So the second doctor is at a loss. He doesn't or she doesn't know what has happened in the past. So then, because we need to know the past history of the patient, sometimes they don't divulge in that. So then we are lost completely because the patient does not tell us. It's not written on the forehead, no, how many abortions she's had.
Yes, and this could also be the reason for infertility, right? And
so this products left inside can give rise to what is called as tubal block, and that can proceed to secondary infertility. She's got pregnant once.
Yes.
She's aborted.
Yes.
Now she's not getting pregnant.
Yes.
So that's called as secondary infertility. So then they go to the doctor. Okay. Then we do laparoscopy and HSG and tube testing, and they say, hey, your tubes are blocked. Therefore, you need to go for IVF. Then they spend 4 lakhs for the IVF. So this is what majority happens. They unwantedly, we are not prepared for the pregnancy at this stage. We've been just married 6 months. We want to see Spain and we want to go to Japan and see the Sakura and then get pregnant. I mean, I don't understand this. If you're knowing about Sakura, why can't you take a OCP and prevent a pregnancy? I mean,
yes.
Simple thing, no? You want to go to Japan and come back? Fine, go. But in the meantime, don't get pregnant and get an abortion done. Na? So this is the common thing that, they know a little bit with ChatGPT, with AI, with Google and www and all these things. There's so much of information. The information highway, which is quite extensive.
Yes.
But that highway does not know who Supriya is or who Lakshmi is,
Right.
and who's Supriya's husband and who's Lakshmi's husband. Whether she's an alcoholic or a smoker or a vapor, that www doesn't know.
Yes.
They just write 1, 2, 3, 4, 5, 6, 7. This is what it is.
It's an algorithm. It just optimizes and gives you what it is.
So they miss the boat and they read and they tell us that I've read about this and come. So about 55% of the population who comes to us, they have already read about it, about what is happening, and then tell us, hey doc, you've not done my blood test. I said, it's not needed. No, but the Google says that you have to do it. I said, do it. You want to spend money? I have no problem.
Okay.
So I'll write and give it to you. Get it done.
Okay.
All comes normal. But they're content because they have read it. The doctor has asked for it. The reports have come.
It's a confirmation bias.
Absolutely.
And you also definitely get irritated when...
Obviously. I mean, having studied for 8.5 years and practiced for 45 years, and that girl who's just 25 years of age telling me what to do, I said, hello, this is not needed. I mean, I don't tell you how to prepare your coffee at home. Your job is you have to make coffee for your husband. You do it the way he wants it.
Yes.
I mean, I'm not going to say boil the milk first and add coffee powder, add the sugar and then add the water and serve it. No? Yes. You may want to boil the water first, add coffee powder, milk and then give it to him.
It's your style.
Your style, yeah. But telling us as a professional, I mean, there are a lot of people who tell us what to do and what investigations are needed for.
So they come with a prescription.
They come with the idea of a prescription.
Huh. They just want you to
validate it and give it to them.
Okay.
So I try to tell them once nicely and that it's not needed. If it can be sort of avoided unnecessarily, it's not. I mean, these people have got wrong information, not knowing what is applicable to them. They have got money on their hands. They know it's just swiping a card.
Mm-hmm.
So that's they know we are rich, as you call it, that they have got abundance of everything and they just want to see that everything is done. Yes. So many people, why don't you do this scan? Why do I want to see my baby? Hello? You're doing a scan. You're not doing seeing a baby and taking a picture of it. It's going to be black and white, After the baby is born, nobody sees them. They want the mother-in-law or a nanny to look after the baby. They are busy with their, kitty parties and, card games and partying and going in the afternoon and meeting the friends. And the baby is with the nanny. In the pregnancy, I want to see my baby. But after the delivery, nobody wants to see the baby.
Okay. Doctor, we'll come to very, very simple. Maybe it's like a rapid fire thing. What's the difference between PCOS, PCOD?
Same thing. PCOS stands for polycystic ovarian syndrome and PCOD stands for polycystic ovarian disease.
Okay.
There's no difference. The same nomenclature used by different groups. Okay. But the common thing is because in the scan also you will say polycystic ovarian response.
Okay. What kind of sanitary products are good for menstrual thing? There are so many things from
a to a cup to a
top
tampon.
Pad to tampon. What is?
One is what I would say is most people. I mean, as a male, I will not be able to really enlighten you on this much. But the point is, now the cup is used quite rapidly and rampantly, and people change over to the cup very fast. Mm-hmm. They say that it is sort of more comforting to have a cup in situ. Easy to wash and reuse it again. So there's nothing that has to be discarded as such. Mm-hmm. Tampons, costly. Quite a few people retain it inside without their knowledge that the tampon is inside. Mm-hmm. And what we worry about is sometimes they cannot extract the tampon easily from the vagina.
Okay.
And that can lead to what's called as toxic shock syndrome. So I'm little not for tampons as such.
Okay.
Quite a few people have left things behind. And this can precipitate what's called as a toxic shock syndrome, TSS we call it. Mm. And that can be disaster, life-threatening at times.
Okay.
The pads are the best, but sometimes, people don't want to have a pad in between the legs all the time and make sort of life difficult for them. They bleed more than necessary and the pad does not absorb the blood as such. It might be evident outside. So maybe yes, I don't deny that. Cloth is again not sterilized as such. It's washed, and good old days they were using the cloth only. Sunlight is the best thing, vitamin D as well as.
Today in apartment culture, not possible.
Not possible.
Yeah.
You can't dry your flags on this only hair lying there. So cloths are not that, but it's coming to that stage again. I feel a lot of people are reverting back to pads and cloths. So the one which is on top is the
safer, as per your expertise, the safer is the normal cloth pad. Menstrual.
Yeah, cloth pad, menstrual pads, or whatever you're using. Use an extra large one if you want to. And anyway, it's outside the body. You can dispose it of. Only it becomes a problem to dispose it of. But every place you go to, you have proper disposal methods available. And it absorbs the thing and it's not retained in the body.
Yes.
So this is all discarded material which is going to be thrown out by the body. So anyway, absorb it and dispose it off.
Yeah. One question on the cup. Anatomically, it just blocks everything and just airlocks.
Yes.
So is it good, bad, ugly?
I think this you should ask for a lady gynecologist because I have no clue about it.
But no, anatomically, I mean...
most of people are reverting to cups now. They come back after delivery also. So many times the patients ask me what...
But is it good for the body?
Should be good enough because... anyway, the vagina is an anaerobic area. There's no air in the vagina. It's only when you are sitting or squatting that air rushes in. And those ladies who have had multiple deliveries where the introitus is very wide open, the air does go in and come out and makes a sound at times, which is basically a social outcast for them. They avoid going outside because of the sound that they make when they're walking. So the air gushes in and gushes out. Okay. So that makes an abnormal sound. And they feel a little uncomfortable going out.
Okay.
So the cup as such, once you know how to insert it properly and know how to retract it properly and how to wash it properly and reinsert, I think that's the best game ball right now.
Okay. So for a sexually active, explorative girl, what would be your words to them? Protective, preventive, do's and don'ts. And today's hookup culture.
Yeah. With this, present scenario, right, that you have, most girls will experiment.
Okay.
So it is their lifestyle. It's not the doctor's thing to say, don't do this and don't do that.
No,
you pick up what you want to do. If you want to be experimenting, definitely choose the right partner. Be aware of what the surroundings are like. Just don't do it rampantly as such. See that you keep yourself protected by using some protection in the form of condoms to prevent an unwanted pregnancy and to prevent a sexually transmitted disease as such. And the chances of having, say, fungal infection can come from the male partner or gonorrhea or syphilis or chlamydia, which the male will pass on to you through the semen, through the smegma, through the coitus act. So condom definitely needs to be used if you're just experimenting with multiple partners. How you have sex with your partner is fine, your call. But if you do not know the person, definitely use some barrier method. If you're going to get married to the guy in the long run, if you're comfortable saying that, okay, this is the guy made for me in heaven, fine, have sex and experiment. But protect yourself to see that you avoid the fertile period by not indulging in sex between the 13th and the 17th day. Before that, after that, you can have sex without a barrier method, without a condom. But during the fertile period, use a condom so that there should be no social stigma to you that you are an unwed mother. You have a pregnancy happening and then you go for abortions and make a mess of your life.
Okay.
And see that you get your basic investigation done in the long run to protect yourself. So the serology and the thyroid sugars and blood group and all these things should be kept ready. And for heaven's sake, if you have done any blood test, please take a download and keep it in a file somewhere.
Okay.
Because it's better to have a hard copy of the medical records in one place rather than having multiple, some papers and files in the office, some on your laptop and something on your mobile. So then when we ask for investigation, I've got it at home, So that's best avoided if you keep all medical records in one place. And chronological order, just save all the records. So in the long run, these are all going to be helpful for us, especially if you're a diabetic, especially if you're a polycystic ovary, if you have, say, prevented multiple abortions. All these reports do help the doctor to decide what's the next line of action.
Okay. For people going for ECPs, it's a no-no.
Emergency contraceptive pill, I understand. It's very sort of, unfathomed area because they just take the tablets without knowing the repercussions.
So don't do
I would suggest better to use barrier protection. When you know that you're going out with the guy and you're going to have sex, use a condom. Safer, better, faster, easier, and simpler. Rather than, crying over spilt milk and then mopping up the milk when it stings. And if it gets burned, then you're screwed.
Okay. Any parting words, doctor, for younger children? Actually, it starts from 14 to 25, 27. They take conscious choices, mindful choices. But then this period of experimentation, peer pressure, what are your words for them?
The life that you've been given is your life. Make the most of it and do things within limits to see that you are up to the mark. And long-term effects definitely are there for every activity that you do at this age. And try to keep a healthy lifestyle, working out, exercising, dieting, eating healthy food, nutritious foods, good sleeping hours. See that you don't strain yourself. And the most important thing is keep your stress levels as low as possible. Nobody can be stress-free, but you can definitely keep your stress levels down wherever it is. Maybe during the college days, maybe during the career advancement days, or whether you're working, or your family pressure, or your peer pressure from your friends, or in the office. Stress is there everywhere. Take it simple, commuting. That's also stressful. So try to maintain your lifestyle equilibrium and make the most of this one simple life that has been God given to you. It does not happen to everybody. You are the chosen that is to be leading a normal human life, not an animal or a mammal or a tree or a earthly thing which is growing all around you. You are a human being. You have evolved yourself in such a way that you got all your senses with you. And it's God given for you to be that person. So be that person and see that you make an impact on society in general.
Okay. Thank you so much.
Thank you.
It was such valuable, so much of information and a lot of good advice.
I hope so.
Thank
It depends upon the individual who to accept it, to see, decide what's good for them, what's not good
Yes,
for them.
it's always, at least this information is out there, what they can be preventive and what they can protect their health and not cry over the spilled milk. This is information available. It's up to them. The decisions.
Decide, yes. It's their choice. It's their life.
Yes.
We don't want to put a lot of barriers on this. Say, don't do this and do this and don't do this in the long run. You decide. You're educated. You got a lot of AI information available for you.
Yes.
Read it. Decide what's good for you, and don't do things which is going to get you into trouble.
Yes. Usually the questions to an obstetrician and gynecologist would have been different, but this conversation is a lot of preventive health information. And thank you so much.
I hope it helps somebody.
Definitely. I'm just hoping a community would definitely take a lot of benefit out of this conversation. Thank you so much.
Thanks,
so much.
Kritika. Thank you.
And that's a wrap for today's The Life Grids conversation. So yes, please, we really need you to press the like button, subscribe button, and the share button. It really means a lot for us. We enjoy doing this. We are really happy doing all these things. But please comment how this episode was and what we can improvise. We definitely wanted to do better with every episode. So, there are fun bloopers and behind the scenes on the Instagram. So visit us there too. See you soon with another free flow casual conversation with a lot of good insights. Till then, take care. Let's explore every moment of life.